Hi, everyone. I'm Gabby Reith-Miller from the Riley Children's Health social media team. And today we're having a live discussion about COVID-19 vaccines for children 5 and under. And today I'm so happy to be joined by one of our wonderful doctors, Dr. Shapaniak. Thank you so much for being with us today.
Thank you for inviting me.
So, of course, parents with kids this young have been very anxiously, for some, awaiting this news that the COVID-19 vaccine is finally available for their kids. So, what was your reaction? Yes, I know we're cheering for that. What was your reaction when you heard this news and that these parents finally have, access to this for their children?
Yeah, we've been waiting for this for a long time. We were hoping in February, but everybody, FDA has been so careful with reviewing safety data. That's what caused the delay. So we were excited, so excited. So many parents called or sent messages to me asking whether they can come in right now. Uh, well, not everybody can come in at the same time, but definitely, yes, very excited. It's a go. It's a go.
That's great. And so families are, of course, all about protecting their kids and making good choices when it comes to their health care. So, can you fill us in a little bit on the research that went into creating these vaccines and ensuring their efficacy?
Yeah, absolutely, absolutely. Research was a little complex, so let me divide it into three different segments. So when the both producers of Moderna and a Pfizer vaccine, when they did their studies, they focused on effectiveness of the immune response to the vaccine, effectiveness in preventing COVID vaccine, and overall safety, deep down dive to safety. As far as effectiveness in immune response, how your body producing antibodies in response to the vaccine. Moderna producers had about 230 children, followed 230 children aged 6 to 23 months old, and over 250 children 2 years to 5 years old. And they shown that immune response in children that age to the vaccine Moderna, that's actually 1/4 of the dose of adult vaccine, mirrors the effectiveness in 18 to 25 years old. So it's a good vaccine, it's effective. As far as effectiveness in preventing COVID vaccine, because that's really what matters to us. Like, if I get a vaccine, will it prevent me getting sick? They had way more children. I think total of over 5,000 children were followed after getting 2 doses of Moderna. And 2 months later, uh, little kids will protect it a little bit better. And when I say little, that means 6 to 23 months old, so almost 2 years old, were protected a little better than those 2 to 5 year old. So 50% of little ones and close to 40% of 2 to 5 year old were protected against COVID vaccine. And actually, the biggest concern of the parents of those little patients is safety, side effects. So, what are the side effects? So, to summarize it quickly, the side effects are very similar to the side effects of all the other childhood vaccinations. Kids get cranky, sleepy, little irritable, sometimes get a low grade fever, very rarely high grade fever. Sometimes may experience redness at the vaccination site with some tenderness around it. Little kids got vaccinations usually in their thighs, so there may be swollen lymph nodes there for a little while. uh, Really nothing unexpected, nothing that makes me worried. Moderna reported a little bit more of vomiting and diarrhea, mild, than Pfizer, uh, but none of that were significant to make a decision and which one is better. They both are equally efficacious and equally minor side effects.
Okay, that is great to know. And I'm sure, when you kind of weigh the benefits of these vaccines, preventing your child from being infected with this virus is so important. So keeping that in mind, if you see them have those minor side effects there.
Yeah.
And, as families plan, obviously these vaccines require more than one dose. So can you walk us through how many doses are required for each one to be considered, fully vaccinated?
Yes, I have a little chart here to be very precise. So Pfizer requires three vaccines. And the reason for that, it was that when they did studies during Omicron surge, third dose was required to actually protect effectively against Omicron. So if your child is getting Pfizer vaccine, you will get dose one. then in 3 to 8 weeks, dose 2, and then at least 8 weeks, but can be more, dose 3. So Pfizer is 3 doses. Moderna, it's 2 doses, and they should be at least 4 and at the most 8 weeks apart.
And, for us as adults, sometimes it was okay to have your first round of, 2-dose vaccines from one brand and then get your booster from another. Is it okay at this point for children to mix and match, or should they be sticking to, one specific type of vaccine if that was their first one?
So, like our infectious disease doctors say, the research on vaccines and COVID is changing every day. So, whatever I say now may be outdated in 4 hours, or maybe by the time we're done talking is outdated. But at this time, we don't recommend mixing and matching vaccines, but that can change any day.
Okay. And boosters, of course, come to mind because we've all had those boosters recommended as adults. Do you foresee the same happening with children in terms of how long the efficacy will be really high of these vaccines and perhaps wanting to reinforce that antibody response down the road?
Okay. Yeah. So I foresee, as a general pediatrician, I foresee that's coming, but right now we don't have recommendation about it. The way my the way I'm thinking about it is, since the response in children and infants was similar to that of young adults, and we know that young adults' immunity is wearing off after 5, 6 months, I foresee that the boosters are coming, but we don't know yet. And due to safety, due to the profound commitment of safety, we want to wait for the thoughtful review of all data before we start recommending.
Okay, that's great to know. Just kind of keeping an eye on things as new research comes out. And for so many parents, COVID has really impacted their child's schooling or daycare. So I know a lot of families are eager to get their child vaccinated, perhaps before starting kindergarten this fall or things like that. So, based on the timeline of the doses, does that mean getting the child vaccinated as soon as possible
Yes.
so that they're ready? Tell me about that.
So you notice how now schools are starting earlier and earlier. Some of my patients starting school in late July, which is very surprising to me. So in late July, you will not have 8 weeks. You will not have enough time to get 2 doses, but please start as soon as possible so you can finish before September, before some of the sports season starts. So as soon as possible, call your trusted pediatric healthcare provider, whether it's a pediatrician or whether it's a family doctor. Call them, ask them whether they have vaccines available in their offices, or we'll talk about other ways to schedule a vaccine, but please don't wait.
Okay. And so let's say a family's planning that out. They're saying, okay, we got to get an appointment going, but oh, wait, my child had COVID. Should that play a factor into deciding when to get them vaccinated or anything like that? And so many people were infected, over the last 2 years.
So that's the question that we presented as primary care doctors to our infectious disease experts. And they said, yes, as soon as you're asymptomatic, don't have any, you're not sick, you should get a COVID vaccine. They also said that it's okay to wait 6 or 12 weeks after COVID vaccine, but after 3 months, you should definitely got a COVID vaccine. So it's safe to get immediately after the infection. If you want to wait 3 months, okay, but don't wait much longer. Now, the important thing to remember is that COVID vaccine provides a broader coverage than COVID infection, because COVID vaccine is designed to cover all the existing variants, give you immune response to all the known variants that were known at the time that the vaccine was produced. So I recommend getting vaccinated as soon as you're done being sick.
Okay. And, of course, throughout this pandemic, we have seen that some folks out there do have some hesitancy about getting vaccinated, about having their children vaccinated. So, what do you want to share with those families? Maybe those that are on the fence trying to figure out what to do when it comes to this particular vaccine?
And that this is the most important question, because we all hear how COVID doesn't affect infants and little kids very much. Like, kids don't get sick very much, but what we lose perspective on is how many kids died of COVID. This is a very, very sad statistic that over 400 children died in the United States since the beginning of epidemics. If you look at other vaccine preventable diseases that now we have vaccination for, let me give you an example of chickenpox. Chickenpox. Before we had vaccination of chickenpox, about 16 children died of chickenpox, varicella infection, every year. In the last 2.5 years, we have average of close to 90 children dying every year. Little, and I'm sorry, I'm talking about little children dying every year due to COVID infection. So COVID is a fourth leading cause of death of infants and fifth leading cause of death in children less than 4 years old. This is a serious infection that kills many children. That's why you need to get immunized. If you don't, if you think 400 children in 2.5 years is not that many, or 86 a year is not that many, there have been thousands of children that suffered through multi-system inflammatory disease caused by COVID, and close to 70 that died of that. And the fact is that nobody can predict who can get this MIS-C, the syndrome, inflammatory syndrome from COVID, and mostly healthy children get that. So this is not a mild disease. We need to immunize our children.
Very powerful statement there. Thank you for that, putting that perspective on there of how many children and families have been impacted by this. And so the group that's left, right, without that vaccine access right now are those very little ones, under 6 months. So if there's a parent out there with a child of that age, what do you recommend for them? Obviously, one is waiting till their child is old enough, but do they just adhere to those precautionary measures? Because I mean, COVID is still very much out there.
Yeah. So we want to protect our little ones, of course, with our whole hearts. The good news is that kids till about 4 months carry maternal antibodies. So please, all the pregnant ladies, please immunize yourself to give your babies a little boost of antibodies that to protect your children. Breastfeeding in general has been shown to protect children against viral and bacterial infections. So breastfeeding is also important if possible. Even if you need to give supplement with formula, whatever breast milk you give your child is very, very, very important. And being careful, being careful. So making sure that all adults and children that visit are immunized for pertussis, whooping cough, for tetanus that comes with pertussis, but also for COVID. So people that come over should be immunized to protect the child from getting COVID and getting to the age when they can get the COVID vaccine.
Great advice there. And so if someone's watching this and they say, okay, I am ready, what do I do? If they have a Riley primary care physician, is that available or going to be available in the offices? Do they need to make an appointment specifically to get that vaccine access from their primary care?
So we chose to have Moderna available in our offices. We wanted to avoid confusion of having both vaccines because they are slightly different in dosing. So we chose to have Moderna in our offices. We have it available now for a week. Our staff has been trained. You can call us directly to schedule a nurse visit, or Gabby at the end of this presentation will show you. We have there's a phone number 211, which is an excellent phone number to call and schedule COVID vaccines in available COVID clinics. Due to the efforts of all the pediatric providers within IU Health Physicians, we created 5 COVID clinics that are open in the evenings and on Saturdays.
Yeah, thank you, Dr. Shapaniak, for sharing a little bit of that. I'm going to maximize that slide here so the folks watching can take a look. There are 5 places where if your child is of this specific age group, they can go to get the vaccine. And as Dr. Shapaniak mentioned, you do still need to call 211 to make an appointment to get a vaccine there. And we will have this information listed in the caption of this Facebook Live. So I want to just bring Dr. Shapaniak back here for a moment as we wrap up this conversation. Thank you so much for doing this. I hope that it's helpful to families out there. Any parting words, anything else you want to share with the people watching this?
Thank you. Thank you for watching. This is important. Please get your children immunized, COVID and all the other vaccines, because we want them to grow out to be healthy and well adults.
Great. Well, thank you so much.
Thank you. Bye-bye.